I think One Medical is definitely making healthcare more accessible in a way that you don't have to get into the hustle of trying to call the clinic and be put on hold for like a long time to talk to someone, and you don't have to wait for the phone call to go back to get your report from your lab test, and you don't have to you don't have to go back, you don't have to get the phone call about how much you're owed. You don't get paper billing, which helps the environment, and also you get that information a lot quicker.
And I think they make it super accessible while being through being digital focused. I have the app on my phone. If I need a prescription refilled or I need some sort of information, they have a medical team if my doctor's not able to answer right away. So I think that it's definitely accessible.
Different options for patients. Um, and they do look at the different things that patients could come up, that could come up with different patients. So in that respect, I think that they're doing a great job just with the options that they have and just with the accessibility they have. So I would give them high marks for that.
I think generally it is more accessible because there are many locations that you can kind of like reach out to in order to get care.
I liked how easy it was for me to get the care I needed, to talk to someone, describe what was going on, and to be able to, get some answers.
Um, I think that because it is virtual, it does make it a lot more accessible. For me, and as well as my mom works much different hours than me. She works night to night shifts, so she works about uh, 6 7 p.m. to 7 a.m., and I work about 9 a.m. to 6 p.m. And for both of us, being able to access virtual healthcare is very important because our hours are so set in the day that we don't have time to go outside of those hours to go to a doctor's office, because the hours that I'm working are typically the hours that you would need to go into an office because most doctor's offices close at about 6 p.m., which is when I get off.
Is it was a good experience for me personally, and it was kind of easy and accessible to find like the care I needed at the time.
I was able to get the care that I needed, and it was quick, and I did feel like they were listening to me, and they cared about me more than you know what I've experienced in the past.